one of the things I have to say from the outset, if I may, is that legally, as part of the Equalities Act, every terminally ill person is disabled. That's why you have fast tracks for benefits for cancer diagnosis and all sorts of things. So it is a complete misnomer that people with disabilities, disabled people, are not part of this bill or eligible within the terms of this bill.
The health service already shows a complete misunderstanding around what Down syndrome is. It also, to me, underpins a heartfelt belief that there is an institutional bias towards disabled people, and particularly people with learning disabilities.
Welcome to the UK Medical Freedom Alliance. We are the most recognised and respected organisation campaigning for your right to informed consent, bodily autonomy and medical choice. We are the voice of ethical medicine.
Hi everybody, welcome along to another UKMFA podcast, and this is all about assisted dying. So it's part of our assisted dying series, and hopefully you would have seen the previous episodes. This is a very, very important topic. It's a very emotive topic, and it's something that we really want to get into because we know that this continues to appear in Parliament, and they're determined to get through the terminal illness bill. Anyway, as usual, my guests are Amanda Hunter, who's been leading on this series and doing a most amazing job. She's an awful lot about presenting, haven't you, Amanda? She's done very well. And our CEO from UKMFA, Dr. Liz Evans. And joining us today, we have George Fielding. He has had British Empire Medal and is a social entrepreneur and systems change leader working at the intersection of disability rights, youth empowerment and inclusive communities. The proud co-founder of Insightful Disability, the UK's disability intelligence infrastructure organisation, is a manual wheelchair user with cerebral palsy, and he's previously mentored over 100 young wheelchair users, contributed to more than £15 million worth of raised funds for disability causes, and helped to broker so much more. And at 19, he got the British Empire Medal. Go, George. Good stuff. Ken Ross, well, he's been involved in improving outcomes for people with Down syndrome since 2004. That's involved producing films showing people with Down syndrome in powerful roles, notably My Feral Heart and Innocence, and being vice chair of Portsmouth DSA, who are the largest provider of free specialist educational services for students with Down syndrome. That organisation provides specialist staff to over 100 different schools. He's the founding officer of the NDSPG and co-author of the Down Syndrome Bill Act of 2022. I think I'm going to let you flesh that out even more as we go through the conversation, but just very quickly, I just want everybody who's watching this video and seeing our others, please like and subscribe. I know we always say this, but it really helps us. And there will be a QR code sitting at the top right-hand side of the screen where you can flash your phone at that. And that means you can buy us a coffee, or you can make monthly donations if you wish to, which would be really, really helpful. And if you're not a QR code user, you just drop down into the description and then you will see that the link is there for you from the old-fashioned way of doing it, apparently. Right, everybody, thank you so much. I'm first of all going to hand over to Liz to do the remaining part of the introduction.
Yeah, thanks very much, Ian. And just thank you so much, George and Ken, for joining us today. I think this is a really, really important series we're doing. And your piece in this is a critical piece that I'm really excited to get into. So just in case people don't remember, we had a moment of celebration when the Ledbetter Assisted Dying Bill, Assisted Suicide Bill, as is more realistically should be called, did fall in the House of Lords in, I think it was June. It wasn't that long ago. Because it ran out of time. But sadly, although not unexpectedly, in this new parliamentary session that's just about to start, Lauren Edwards was picked to put in a private member's bill, and she has resurrected exactly the same bill as originally drafted, with all the same flaws, all the same massive gaping holes, safeguarding issues. that had been identified in the Ledbetter Bill during its passage through not only Parliament, but particularly in the House of Lords, where I thought they did an absolutely amazing job of calling out all the issues that we had called out right at the beginning, and all the people who were opposing it had been calling out. The Lords did their job well. They really scrutinised it. They highlighted these serious issues. They'd put in amendments, and then now the same bill is being resurrected from the dead. And so, yes, just want to hand over to you, Amanda, to see, from a disability and learning disability perspective, what dangers this bill is facing to the UK public.
Yeah. Okay. So I wanted to start with you, Ken, and take us back to November and your evidence to the Lords Select Committee. So when you gave your evidence, you raised serious concerns about the bill and its safeguards, particularly in relation to people with learning disabilities and your speciality, Down syndrome. Now that the bill is returning to Parliament as a new private member's bill, has anything changed about your concerns about the risks it poses?
No. So, I mean, one of the points when I was giving evidence was it was to remain neutral on whether the bill should pass or fail. It was more just to highlight the issues that were contained within the bill, because actually, when it comes down to it, the legislators will decide whether or not something becomes law. It's for everyone else to try and ensure that if something does become law, that the best possible safeguards are in place. And one of the things which I suppose really frustrated me and my colleagues through the process was we highlighted some very obvious flaws around safeguarding which could be addressed. And we highlighted that directly to the bill sponsors in private meetings. There's not, these are private meetings, but there are records kept of them. So, they're not privileged in any way. And a lot of it centered around understanding how individuals communicate and understand how individuals could be subject to coercion, whether overtly or inadvertently. And all of those concerns are very, very real and happen in everyday life with people with Down syndrome. Huge misunderstanding around communication, stated intent, huge risk around coercion. And that could be coercion into good things or bad things. And the problem that we felt that the Mental Capacity Act as the sort of named safeguard for this was going to cause a problem was because the bill sponsors thought that people with Down syndrome would largely be disapplied from this legislation because of the mental capacity.
Can I just interrupt you a second?
Sure.
Because that's a really good summary, but we're going to go into more depth in some of those issues as we go on, if that's okay. If I can
no problem at all.
Bring in George. George, again, as the bill returns to Parliament, have your concerns and those of disabled people and their advocacy organisations changed in any respect? Have they deepened?
Well, nothing has changed. Everything remains unresolved, and Liz was incredibly correct. The Lords did an absolutely wonderful job of scrutinising this bill that fell, and very few of the safeguards of the amendments were actually passed. And because the bill fell, we're back at square one. So of course nothing has changed. One of the things I have to say from the outset, if I may, is that legally, as part of the Equalities Act, every terminally ill person is disabled. And that's why you have fast tracks for benefits for cancer diagnosis and all sorts of things. So it is a complete misnomer that people with disabilities, disabled people, are not part of this bill or eligible within the terms of this bill. Indeed, it can, and I think more accurately, be described as a bill that is trying to provide an alternative final solution for the people that our state and our systems have failed for generations. Now, it is in that sense deeply, deeply worrying to me that 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 we still have a parliamentary system, a system that doesn't engage with. We've had to fight at every stage to get the voices and the organisations to give evidence. And Ken was one of the most capable, but only people to advocate from this perspective. This is going through without any scrutiny or platforming from disabled people or disabled people's organisations, and that, I have to say, it has been engineered, and thus far looks to be on purpose, and in that sense, alongside all of these things about how we safeguard, how we support people with disabled people, how we want to build their voice, keep them safe, acknowledge the realities of things like the fact that 1 in 10 domestic violence cases is perpetrated by an unpaid carer because houses, all of these things. But what we need to scrutinise is how the fact that everybody who is a proponent of this bill seems to either be coming at it from a position of privilege or trauma without realising the collective harm that is being that would be made to the vote. I don't like the word, but the most vulnerable in society.
Thank you, George. Coming back, picking up on a couple of points you made, I totally agree, obviously, that this does apply to disabled people for the very reasons that you explained. And it's something that Tanny Gray-Thompson, as a disabled peer, has brought up many, many times also in her evidence. And she was sitting with you, Ken, and with Alistair from the ECHR, who was there also from the perspective of equality. But Tanny was there, and she brought up a couple of very pertinent points around this, particularly around, for example, cystic fibrosis, which people would come under the eligibility criteria. And also people with pressure sores and she talked about 3 people known to her who died of pressure sores. So these are, it's disingenuous to say this does not apply to disabled people. But then you will have disabled activist Tom Shakespeare, who was also on the panel with you, who was saying, no, this doesn't apply to disabled people. And in respect of people with Down syndrome, you're saying, well, and it was in the context of training. Well, yes, you can have general training. Everybody's trained in learning disabilities now. But, we can't have specific, training around Down syndrome, which really gets to the heart of your point, Ken, doesn't it?
Yeah, I must say I was surprised. Well, maybe not surprised, but I was very disappointed that Tom Shakespeare was able to throw around some statistics which were largely unfounded. And it's not to say that he didn't find a poll of a particular group of people who said something at some point. But one of the things which is very important, I feel, is in Scotland, the largest cause of death of people with learning disabilities is listed as Down syndrome. So that within the health service already shows a complete misunderstanding around what Down syndrome is. It also, to me, underpins a hard-felt belief that there is an institutional bias towards disabled people, and particularly people with learning disabilities, through a lack of understanding and a lack of ability to effectively communicate with these people. And if we can't get past that, we will never start to see people being valued in an equal way. When you look at life outcomes, employment stats, 94% of people with learning disabilities in England, which is the highest employment level in the UK for people with learning disabilities, 94% are unemployed. So that again shows that whatever the state thinks they're doing to create equality under the various different acts they've done, they haven't actually done it yet because they haven't come up with an outcome which is remotely fair. In America, it's about 51% of people with learning disabilities are unemployed. So, yeah, there's a very different approach to how disabled people are seen and valued and included in life. To one of George's points, when we start to think about how people don't receive the right care and treatment through their lives, you then start to talk about avoidable deaths. So you talk about people who are potentially being listed as being within 6 months to live, but it's only the system that's a product. They're a product of the system failing them that have got them to that position. So again, the restated leader report shows that 41% of deaths of people with learning disabilities were avoidable in England, and incredibly 10% more for people with Down syndrome. And people with Down syndrome routinely will die about 20 years earlier than other people with learning disabilities. So you're already talking about people who are enjoying life for a much smaller amount of time. You're talking about people who have manifestations of certain medical conditions at an earlier time, which, if untreated, is going to fast track them onto a path towards an early death. When we were looking at speaking with the government and helping to try and guide some safeguards, we cited research undertaken by Baroness Hollands in Holland, where she showed that similar legislation was directly used to target people with learning disabilities, even though that wasn't on the face of the legislation, nor was it meant to be the primary cause. And one of the things which we found pretty disingenuous was, to start with, when it was going through the Commons, we kept being told, stop comparing it to other jurisdictions. Then suddenly, in the Lords, everyone was quite happy comparing it to other jurisdictions, particularly if it suited an argument around a particular place in America. So, there's very much a lot of picking and choosing. Sadly, there's an awful lot of choreography that goes into committees, particularly in the Commons stage. I mean, it's largely handpicked by the bill sponsor, and it's usually stacked in favour of people they know want the outcome that they're pushing for. So disabled people are struggling to get their voice heard because it's inconvenient for the state to actually fess up and do their job properly, which is ensure at all times that disabled people are treated equally and fairly and with the same respect as everyone else.
Yeah, thank you. I'll bring George in now, but I just wanted to come to one. In fact, Alistair Henderson went on that in that evidence he was giving with you. I mean, he pointed to what was then a recent statistic, which was that of people on the NHS waiting list in, I think it was July to August 2025, so a couple of months before, 41% of people with disabilities were on the NHS, showed that 41% of people with disabilities are on the NHS waiting list compared to just 10% of those who are not. And I think that really illustrates the inequalities of access. Can you talk about that a little bit more, George? The inequalities of access that are forgotten, and the flawed assumptions in the bill around equality of access.
Of course. But if I may, to kind of bounce off Ken, I just want to give a shout out to a dear friend of mine called George Julian. The reason that George Julian's work is so important in this space is that she live tweets every coroner's case that is arguably, not arguably, most of the time, a case of an avoidable death of somebody with a learning disability. And pretty much every week there is a case in a coroner's court where the case being debated or scrutinized legally is a case of somebody who has passed away too early from who has a learning disability, and indeed we're still in a position where there are hundreds of people with autism on delayed discharge of assessment and treatment units, which are basically prisons where people with autism are and other conditions are over medicalized, in over sedentary environments, and they never get out. And when I was working more directly in this area in social care, one of the key reasons as to why these individuals were basically locked away in secure units, never to be let out, was because the parents and their carers had the temerity to ask for respite, and it was respite that the local authorities couldn't, or other organisations couldn't provide. So those are the kind of dark circumstances and the dark realities that we have for a long time institutionalized and made invisible the very people whose problems we don't think we can solve. There's a fatalism and a negativity to this whole thing, because we can do so much better for every disabled person. But back to your point about the inequalities of access. It is always going to be true that the healthcare system sees life through a medicalized lens. The disabled community, to the extent that it exists, see and like to focus on the social barriers, the fact that lifts are broken, you can't get on a train. There's many reasons why many people just cannot get out of their own house because of structural inequalities. Now it is just a fact of life that I will have cerebral palsy, and most disabled people will have their disability for the rest of their lives. Now, and that is an inequality that needs to be spoken of, because actually, when I go to the doctors, I'm not asking for help with my cerebral palsy. I'm asking for help with an underlying episodic thing that's very simple. And so most of the things I go to the doctor for, and people with disabilities go to the doctor for, are treatable conditions, just like everybody else: coughs, colds, pressure sores, all of these things. And to segue again into what Ken was saying, it is very much true and sad that two of the main reasons why people learning disabled individuals are placed into hospitals are constipation and tooth decay. We are not talking about anything but basics here. Basics. And I do think that is what's propelling a lot of this, because whomever it be, whether it be Charlie Faulkner, Kim Ledbetter, Keir Starmer, Andy Burnham, they do not want to recognise that within this system we are struggling to address the most simple dignities for people, and that is a very key and loaded word here: dignities. Because I want every individual's dignity to be addressed so that they can live joyfully, freely, and in abundance. But day to day we have worries. I'm 31 now. I'm not worried about my death. I'm worried about what might happen tomorrow. But there is, as I said earlier, a lot of trauma. We've all seen people die, and unfortunately in circumstances we wouldn't wish. But I would just simply say, as I say to a lot of people, if the only thing you're worried about is your death, then that is quite a fortunate position to be in.
With heartfelt thanks to Ken and to George, to Amanda and Liz, I'm just bowled over by the content of what you've just seen. That's 20 minutes of a conversation that actually went on for well over an hour. The other 40 minutes or so is available in 2 separate chunks. Please dig them out and have a look. Go to our YouTube or our Substack and you can find the videos, or go on audio to Spotify on Apple and you can watch it there. Please, you've got to see the whole thing. It's so important, and many people just do not realize the ramifications of the terminally ill bill.